Lifestyle factors we've run through: exercise, diet, time in nature, relationships, recreation, relaxation and stress management. Now, for those who are open to this, religious and spiritual involvement can be extremely beneficial. There's now a large amount of research showing, actually over 1,500 studies on the relationship between religious, spiritual involvement and health. It's a mixed, complex literature, but in the general principles are, overall, it seems that religious, spiritual involvement can be very beneficial to both physical and mental health. But it depends to a significant extent on the kind of religious involvement. And the general principles are for involvement in religious systems which emphasize guilt and punishment, not so good, not surprisingly. On the other hand, for religious, spiritual systems which emphasize love, compassion, forgiveness, etc., the evidence is clear. This is intimately linked to both positive and physical health. Just how dramatic this can be is shown by studies that people who attend religious services at least weekly survive approximately 7 years longer than those who don't. And that's after you take into account that's after for controlling for baseline health and health behaviors. This is an enormous difference. And of course, there are all sorts of factors here, from social support to more likelihood of making use of and adhering to medical treatment, etc., etc. But it's a dramatic. That's a couple of packs of cigarettes a day. So religious and spiritual involvement, contemplative practices, now an enormous body of research on meditation and contemplative practices. By my figuring, meditation is now the second most researched therapy after the behavioral therapies. Over 1,000 studies out there, as far as I can figure, with certainly evidence for a wider array of effects, from psychological all the way down to chromosomal now. Lot of benefits for a variety of psychological disorders. There's almost nothing that doesn't seem to have been tried for now and found beneficial for a significant number. To just focus in let me just suggest some of the benefits that are useful for mental health professionals, because there's now more evidence for the benefit of meditation for mental health professionals than for any other psychotherapy. And some of those benefits include capacities such as reduced stress, enhanced psychological well-being, and maturity. That is, on scales of adult development, people who take up these health professionals who take up these practices tend to show significant gains in psychological maturity. There are also enhanced capacities such as empathy. And you'll remember, for example, from Rogerian therapy, accurate empathy being one of the key characteristics of the most successful therapists. Also evidence that therapists who practice these gain in things like calm and concentration and self-actualization. And also, in the last year, there's a study out which I've been waiting for about a decade for. In fact, someone did an interventional study with teaching one group of therapists in training meditation, another group as a control group, and then measured the therapeutic outcome on their patients and found a significant improvement in therapeutic outcome among the patients of the meditators, which makes sense given the kind of qualities that are being developed here.